I'm Bonnie Tandock. I'm a provider at Health Ministries Clinic, and I've been here for 5 years, maybe more. I've been in Newton practicing OBGYN and family practice for longer than I want you to know. I was diagnosed with breast cancer in 2006 on our wedding anniversary, a week before our daughter's wedding. And it came as a surprise, as it does, I think, for most people. I had been experiencing an unusual symptom of burning, a burning sensation in my breast for several weeks. I thought it was probably due to excessive caffeine intake, so I quit drinking caffeine, and that sensation did not dissipate. So I went for a mammogram, and a small mass was detected. Then I proceeded with a diagnostic mammogram and biopsy, which proved to be positive for malignancy. I think having breast cancer can change your life dramatically if you choose to allow it to change the direction of your life. It could. I felt that cancer was not going to define me, and I would forge on with my life, set goals, live my life as fully as possible, enjoy my family, and I had wonderful support. Not only did I have an excellent healthcare team, but I also had a very supportive husband and family. We dealt with it as people do. It's harsh and it's difficult in the moment, but I think looking forward and planning to continue living is probably one of the most important things one can do to survive it. We planned as I went through chemo and radiation and suffered some of the side effects from those treatments. We decided that we would work together to enhance my living, help me be the best I could be during that time frame. My husband was very creative. We had spent probably a lifetime doing many things separately. He played tennis. I played tennis very poorly. I played racquetball, also not very well, but I played tennis even more poorly than I played racquetball. We decided that we would do something together, learn something new together, and we took up dancing and did that together for a number of years. And it really helped me with the effects of chemo and brain fog and, keeping myself intact during that time and after treatment. So it was good. I think planning ahead, working together, and setting goals and living life to the fullest helped the most. After you have a diagnosis of cancer of any kind, but I think breast cancer, certainly that's my experience, always leaves you just a little bit fearful. I think that feeling sick in any way makes you immediately think, oh no, could it be? Could it be that I've got cancer again? If you can be reasonable and logical, it certainly seems like that's probably not always the answer. But I think it's very important to continue regular follow-up with your provider. It's very important to continue with mammograms and lab work as necessary to be certain that you are well. So many women remain hesitant and fearful about the diagnostics, particularly a mammogram. And I have to say that momentary discomfort with a mammogram is nothing compared to what you could live if you didn't get screened and experience the opportunity for early detection if you did have breast cancer.